April is Testicular Cancer Awareness Month, and Dr. Benjamin Garmezy tells us what young men need to know about it.
Hi, I'm Ben Garmezy. I'm a GU medical oncologist in Nashville, Tennessee, practicing at SCRI Oncology Partners, and also leading the GU research program for Sarah Cannon Research. And testicular cancer is actually the most common cancer in men ages 15 to 35. The most common diagnoses happen above the age of 20 and under the age of 35, but it can actually happen anytime up into your 40s, 50s, 60s, et cetera. So it's something that we should all be aware of. Now, that being said, while it is more common and the most common cancer in young men, it is still a pretty rare tumor. So it's not that many men are succumbing or being diagnosed with this disease. It's actually still pretty rare. But you may know somebody who had it because it is common in that young male population. And because when young men get cancer, there's obviously something that is talked quite a lot about. So that's one thing to know. But then let's reassure everyone who's listening today. Testicular cancer is a very curable disease. No cancer is a good cancer, of course. Cancer is scary, cancer is stressful, and cancer requires treatment that causes side effects, right? But not over 90% of patients who are diagnosed with testicular cancer will be cured. And when I see a patient with a new diagnosis, the first thing I tell them is, this is likely not going to be something that is terminal. This is just going to be a big headache, a bump in the road, a speed bump in life, and something that'll just be kind of a bad and scary memory in your rearview mirror. Is when should I be concerned? And honestly, it's not a disease that we do routine screening for. Now, certain guidelines do recommend doing self-testicular exams, which means once a month in the shower, in the bedroom, privacy of your own home, just taking your two fingers and kind of rubbing them around your testicles and making sure that they're not growing or adding new bumps in size. Now, it's okay if one testicle is a little bit lower than the other, and it's okay if one's a little bit bigger than the other. That's totally normal, just to reassure all the young men out there listening to this, that is normal. What we want to look for is changes or bumps that don't feel right. Now, you're going to feel a little bump on the top or the middle of that testicle on the outside because the testicle's attached to cords in your body, right? Tubes. It has a biological function. That's normal. But what you want to know is there changes? Now, let's say you do find swelling or a new mass. Should you panic? The answer is no, you probably shouldn't panic, but you probably should go seek help. And that's when you either go to your primary care doctor or a urologist to get an ultrasound of the testicle, which is a very non-invasive way to just image that and see if it's something that's concerning for cancer. Oftentimes there's swollen vessels called hydroceles and varicoceles and fluid that can get there for various reasons that are totally benign and not going to be a problem. That can be distressing when it happens, but it's best not to ignore it because, as I said, cancer is so curable, and most patients, if they catch it early, don't even need chemo to cure their cancer. Surgery alone is enough, and then they go back to their daily lives.
Again, as Dr. Garmezy said, more than 90% of people diagnosed with testicular cancer are cured, but there are those few whose cancer does not respond to initial treatment. That's called refractory testicular cancer, and patients are offered stronger chemo. They can also undergo an autologous stem cell transplant where white blood cells are removed during chemo and then put those blood cells back in if the cancer is persistent. There are clinical trials happening right now at the Sarah Cannon Research Institute. But that's good to know that, you know, like with many things, if you catch it early and treat it early and jump on it, the prognosis is very good.
Yeah, so again, do that. And also, men, do those physicals. Those annual physicals is very important, and maybe catching that as well. So.
Yeah, one thing that I love is how he says, you know, it just may be like a bump in the road, and it'll be maybe something in your rear view that you'll look past and be like, hey, that was a lot, but you know, you get through it. So there's a lot of treatment options out there, so that's good. All right, so to check out other helpful tips and information, just head over to newschannel5.com/letmehelp. And if you have any questions, just email us at letmehelp@newschannel5.com.